Hello, good afternoon, ladies and gentlemen. Just to give you an overview of how medicines and medicines waste is controlled in the UK. As you know, in the UK, healthcare is free at the point of use. So people don't have to pay for anything. You go to your doctors, you don't pay. You come to the pharmacy, you pick up your medicines, and you don't have to pay for it, which is good. So again, you have lots of people getting medicines. I think most adults, they say they are on at least a medicine or more, and as they grow older, like the over 65s, they'll have 6 medicines, 14 on this one, and so forth. So there is high use of pharmaceuticals, more than most countries, and part of it is because it's there. You can go to your doctors and ask for it, and you'll get it. And of course, they're getting it because they are ill. So, you do need those medicines. I mean, back in Africa, we don't have the medicines, and no wonder you look at the life expectancy, it's much lower. So, we pray every day. Here, they take medicines every day. That just keeps them alive. Okay, so this is about it, and I'll show you now what happens, because obviously it's not everyone who takes these medicines. Most people are well educated to bring them back to the pharmacy. Again, they come to the pharmacy. It's not the responsibility of the pharmacy to pay for it. We just put them in yellow bins and they're taken off for incineration. So again, the NHS covers that. National Health Service through the Department of Health covers all that. So we don't have to foot that bill. And of course, we know as well some expired drugs can go into that waste. And again, that's covered by the NHS, which is very good. And we know those medicines just don't go and get thrown into some dumpsters. They have to take them to regulated carriers of waste who actually incinerate it. So it is burnt. It's not going into a landfill. All right. And that's all controlled under the Hazardous Waste Medicines Act regulations of 2005 and the Waste regulations of 2011, if I get that right. All right, so I'll go downstairs now and show you all the rubbish after the people have thrown away the medicines. Okay, so the yellow ones are pharmaceutical waste, and the blue lids, these are for the clinical waste, usually the diabetic needles and so forth. So they go there. The good thing, as far as we know, is they're incinerated. I mean, I don't know what pollution we get from burning them, but these go there for incineration. Yeah, I mean, we get a lot of these, 23 to 30 per month that are filled, and they come and pick them away. So generally as well, there is anecdotal evidence that people actually don't return medicines from where they've got them, especially when there's so many of them. Because, we're humans. You think, I've been ordering and getting all these medicines, and now they're just going to be sent back for throwing away. So they tend to go to a different pharmacy to send them back. And we hope they do that and don't just throw them into the bin or down the toilet. But yeah, this is what we got, pharmaceutical waste, quite a bit of it. The usage, obviously, of these medicines, pharmaceuticals in the UK is very high. So we know that we are always passing it on, isn't it? Through number 1 or number 2 in the toilet. So, so there's that as well. And we know our water systems are not very well designed to clean out the drugs. So we know that some rivers in the UK have been known to be, affected by, estrogens from the contraceptives, and the fishes, some types of fish have been affected because of the hormonals that we pass on into the rivers. So that's it for now. Thank you very much.
Yes, so thank you very much. Abes, do you have anything to add there? Do we have any questions for him?
Yeah, nothing much, Prof. I think we as pharmacists and yourself in particular, as the researchers in the pharmaceutical industry, you are to blame because pharmaceuticals are not going anywhere. They don't treat. Only the antibiotics, the antivirals, and the antimicrobials are curative. Everything else is maintenance. So you have your high blood pressure, you get a drug. It's not being treated for cure. We have to take that drug over and over again. And this is why we have all these pharmaceuticals.
Okay.
You need to go for genetic engineering.
Yeah, I think that's what we all need. But then the problem is, I know Zuki was talking about nanotechnology, because that's what worries me, right? Because now we are all moving towards nanotechnology, in the vaccines and all of that. So soon enough, we're going to be picking up all this nanotechnology waste.
Yes.
Right? Which is also not safe.
It's not safe. I think what we need is to change the genes. If you've got your diabetes, let's sort you out, not give you drugs every day and then flood our rivers with metformin.
There you go then. So, do we have questions from other colleagues? I'd like to find out now from pharmacists practicing in places, how do things differ? Gertrude, maybe you can tell us something, and then I'd like Holder to maybe, because I know she works in pharmacy, which shall remain unnamed. Maybe you can tell us what happens. So you're in a South African pharmacy. What happens there? And then maybe Mapapula can also make a comment because you're in an independent pharmacy. Okay, shall we start there?